So I'm just thrilled that we're kicking things off today with a keynote presentation on bringing together the evidence on the effects of nutrition on mental health. And our speaker, Dr. Joseph Firth, is a research fellow at the University of Manchester and is internationally ranked as one of the most highly cited scientists in the fields of lifestyle medicine and mental health. He completed his PhD in medicine at the University of Manchester, UK, and has a bachelor's first honors in psychology from the University of Sheffield. And as much as I'd love to read his entire bio, I'm going to turn things over to you, Joe, and let you actually take things away.
Are we on? Yep. Hi, everybody. I'm Joe Firth. Thanks a lot for coming along today to listen to me present on, if this is working. I think is the clicker working? Yeah, there we go. To present on the overall effects of nutrition on mental health, talking about how at the University of Manchester, where I've been working, we're using bigger data from the epidemiological studies and meta-analyses of randomized clinical trials to answer the biggest questions around which nutrients are evidence-based for which aspects of mental health conditions. I'd like to apologise in advance for my outrageous northern accent. If you can't understand a word of what I'm saying, feel free to email me. Fortunately, I'm a lot better at typing than I am at talking, so I'm sure you'll understand me that way. Here's my declaration of interest, my internal and external funding. Right now, I'm a full-time employee at the University of Manchester, and I have no real commercial agendas. And I'm there researching the connection between a healthy body and a healthy mind. And this is something, really, which is as old as Western medicine itself. We can see this quote from Hippocrates here, widely regarded as the father of Western medicine, discussing how things like exercise and nutrition are the overall best ways to stay healthy and prevent disease. Also, more contemporary thinkers like Thomas Edison have spoken about the importance of using things like nutrition and exercise to improve our overall health. Albert Einstein, another great thinker, didn't actually say anything on this matter, but as you can see from his photographs, he was also a big believer in the connection between a healthy body and a healthy mind. But what is the link? Where is the evidence for the link between mental illness and nutrition? That's what we set out to investigate in the first study that our group conducted in this area. And it's probably important to note here, I'm not actually from a nutrition background, I'm just from a psychiatry and psychology research background. But when we was using the UK Biobank to examine a broad range of different factors which could modify the risk of mental illness, diet started emerging as one potentially very pertinent factor. So we set out to examine this in the UK Biobank, which is widely regarded now as the world's premier data resource due to the depth and accuracy of the information stored here. Use the data from 70,000 individuals collected over multiple time points to actually compute dietary inflammation scores for each person that we had the data for, looking at the pro-inflammatory foods that they're consuming and also the anti-inflammatory nutrients. And this dietary inflammation score has already been validated against biological measures of inflammation. And then we looked at how dietary inflammation was associated with mental health diagnoses. And as you can see from this quite simple graph here with the dietary inflammation scores up on the y-axis, the more severe mental disorders are clearly associated with higher levels of dietary inflammation in the UK population. Conditions like psychosis and bipolar disorder, people are having much higher levels of dietary inflammation than the general population. And even depression, significantly higher than the general population. But while this data is quite compelling and tells a story in itself, it's really hard to tease out the cause and effect, obviously, from this correlation. It could be that dietary inflammation is increasing the risk of mental health conditions, but then, of course, having a mental health condition could equally be making people more likely to have a poor diet, to eat unhealthy, and that's something we've seen a lot in our research. In fact, that was one of the main reasons that brought me to the nutritional field. You see how people with mental illness and mental health conditions, the impact that has on their diet and obesity and things like that, and then vice versa, metabolic conditions being a big risk factor for mental illness. So it's really hard to tease out the actual cause and effect from this correlational data. Yeah, but we've looked at that as well. I've just spoke about that. So what can you actually do to discover if diet has a causal effect on mental health? Well, the answer with everything, the best way to figure out a causal effect is randomized controlled trials. And that's what we set out to do with this meta-analysis, pooling together all the data from randomized controlled trials, 16 independent studies of 45,000 participants, measuring the mental health outcomes of dietary improvement versus control conditions in the general population, in mental health samples. No matter what type of diet or what type of sample, we aggregated all this data in our meta-analysis. And the main findings, quite surprisingly, no effects on anxiety from the dietary interventions, didn't change anxiety levels compared to control conditions. However, dietary interventions did significantly improve symptoms of depression, but most of the evidence was from studies in people with subthreshold or non-clinical depression, so people without major depressive disorders. Although I will add that more recently, since we published this meta-analysis, there's been a number of studies now showing that a Mediterranean diet in particular seems to significantly reduce psychiatric symptoms in people living with major depressive disorders as well. So some additional observations from the meta-analysis. When we divided up the studies in looking at the different types of diets used, all the diets, surprisingly again, had pretty similar effects on depressive symptoms. Weight loss diets, nutrient boosting diets, including the Mediterranean diet, and fat reduction diets, there was no real difference in terms of their effects on mental health. All of these diets seem to work equally. And in the obese samples, people who experienced higher levels of weight loss had better mental health outcomes. Another quite surprising finding was how women benefited more from the diets than men. So here's the graph from the meta-analysis, basically. Some people might be familiar with meta-analyses, some people might not. I'll briefly explain this because it'll come up later on. The center line down the middle, the black line down the middle, represents zero effect. And then each study is one of those red lines on the chart, and the red diamond at the bottom represents the pooled effect on depression across all the studies. So anything to the right of the center line is having a positive, we're seeing a positive effect from the intervention, in this case diet, on the outcome, which is depression. So all in the female samples, all the dietary interventions are having a positive effect on the depressive outcomes. Now when we look at the male samples, you see the complete opposite. All of the dietary interventions, those people receiving the diet compared to the control condition, are actually seeing an increase in depressive symptoms over the intervention period. So it's quite an important finding, but then also some important caveats to that is that a lot of the diets used in the male samples were more like weight loss diets rather than what we'd consider the nutrient boosting diets. And then alongside that, all of the male samples were in non-clinical depression, so people living with subthreshold symptoms of depression. And there's recently been a study just published a couple of weeks ago, so I haven't had a chance to build a slide about it yet, but from a group in Sydney, showing that a Mediterranean diet used in individuals, males, living with major or clinical depression, actual diagnosed clinical threshold for depression, we do see a positive effect of a Mediterranean diet in that group. So the evidence is always evolving, but it's quite interesting to take into account. I've just started there with an overview really of our dietary research, but now I'm going to move on to what we're really here to talk about today, which is obviously we can get nutrition from the diet, or we can also get nutrition from nutrient supplementation. And this is a field, obviously, that's gaining incredible traction at the moment. Nutrient supplements have been used for decades and decades for all aspects of physical health, and they've received a lot of attention. But now, as we know, mental health is really coming to the forefront in the media and across the population as a key outcome. And still, our treatments for mental health conditions are far from perfect. So nutrient supplementation really does stand to be a great place of innovation, and it's getting a lot of interest at the moment from a lot of the population for novel methods for improving outcomes in mental health. And quite encouragingly, another group that found this quite interesting is World Psychiatry, which is the highest ranked impact factor journal for psychiatry or psychology in the world, and also the official journal of the World Psychiatric Association, who commissioned our group to produce a special review bringing together all the evidence of nutrient supplementation in the treatment of mental disorders. So it's a very encouraging sign, really, that mainstream psychiatry is already getting on board with investigating where the evidence actually lies for nutrient supplementation in the treatment of mental illness. So the full report is published online, which you can take a look at in great detail. It's very long and probably very, very boring, but I'll give you an overview of what we did and what we found. Basically, there's such a massive evidence base, it's impossible to review all the studies individually. So we developed a method for systematically aggregating all the top-tier evidence, which is meta-analyses of randomized clinical trials, looking at all the different nutrients, the amino acids, the vitamins, the minerals, whatever it might be, across all the different mental health conditions. And we brought together the data from 33 meta-analyses, testing all these different nutrients in 10,000 individuals with mental illness. And I'll give you a little brief overview of the findings and the evidence to date. So for depression, as you might expect, the most established evidence base existed for omega-3 supplementation. With omega, as I spoke about the meta-analysis graphs before, this is exactly the same thing, just on the right side of the line represents a positive effect on the desired outcome. People with major depressive disorder, even those actually currently taking antidepressant treatment, still benefit significantly, a small but statistically significant benefit from omega-3 supplementation. When you look at the data a little bit closer, there's some really interesting findings within that. And if you actually look at the effect on depression measured in these clinical studies, it's directly correlated, a really compelling association there between the dose of EPA in the omega-3 supplements and the actual benefit on depression. We also looked at the ratio between EPA and DHA, but that didn't really hold a strong relationship with the effect. It seems to be more like the total dose of EPA that was driving the benefits. Some other treatments for depression, vitamin B9, folic acid, you'll all be familiar with that. That also seems to have a significant positive effect. But again, when you break down the data a little bit further, the positive effects in the meta-analyses seem to be driven from high-dose supplementation of methylfolate, methylfolate being the more bioavailable, rapidly absorbed form of folic acid. And when it can be administered in a very high dose, that is the thing that seems to be driving the effects on depression rather than the folic acid trials. And some emerging evidence for N-acetylcysteine, the amino acid that also acts as an antioxidant, along with some what we'd consider maybe preliminary evidence for vitamin D, zinc, and probiotic supplements. Now, the evidence has continued to evolve quite rapidly since we actually published this review, and there's been some new studies coming out. For the vitamin D, it seems to be going, unfortunately, in the opposite direction, with the newer studies showing more null effects, whereas probiotics are getting increasing traction over time in the academic literature, and we're seeing more studies indicating that these could also be beneficial for treatment of depression. ADHD, similar thing, really. Omega-3 being the most widely tested supplement and showing small but statistically significant benefits for overall symptoms of ADHD, but no effects on the cognitive domains in children with these conditions. Bipolar, sorry, I've noticed that these figures are very tiny, but also these are all included in the report online, and other than my nice little green boxes, it's exactly the same, so you might be better looking at that. So for bipolar disorder, similar pattern, we're seeing again, the evidence base is really only there at the moment for omega-3, with some emerging evidence for N-acetylcysteine and amino acids. Anxiety disorders, much less evidence in this space, much less investigation. It's a field that's ripe for further investigation at the moment. We couldn't identify many clinical trials or indeed meta-analyses of those to actually find any strong effects. Schizophrenia, psychotic disorders, which is my main area of research. Interestingly, omega-3 is widely studied here, but there doesn't seem to be any beneficial effects from omega-3 supplementation. Vitamin B9 is there again, with the methylfolate, as we mentioned before, driving the key effects. And N-acetylcysteine and some other amino acids with some preliminary evidence. So I've kind of blasted through the overview there of what we found from these top-tier evidence, and we've also included in the report some of our key clinical recommendations for where the evidence is at the moment and how these supplements might be used to improve outcomes in the treatment of mental illness. And just to say that this review really is not trying to figure out exactly what works. There could be a lot. It's really just shedding a light on where the evidence is so far. So just because something's null in there or not included doesn't mean it's not effective for mental illness. It means it's not been investigated to the extent of the more old school supplements like omega-3s. And it just really highlights the amount of research that still needs to be done in this field for investigating these novel nutraceuticals and their potential benefits for mental health. And with regards to the next steps, what are the next steps? Where is the literature going next? Is it multi-nutrient combinations? We're seeing quite a few different nutrients working for quite a few different mental health conditions. If we just smash them all together, will that solve the problem? Unfortunately, probably not. 3 new randomized clinical trials trying out 3 completely different combinations of nutraceuticals, trying to kind of target the most evidence-based ones and deliver a multitude, a scattershot approach in major depressive disorder, in bipolar depression, and also in the prevention of depression in people with subclinical depression. And none of these have managed to see significant benefits from this multi-nutrient approach. So how about targeted high-dose nutrient supplementation, finding the one that might work and just going big on that? This does seem to be potentially like the way to go. Here's a really good example of a study that did that. Josh Rothman and Donald Goff's group from Harvard University published this a few years ago now, but really identifying that the literature indicates its effect from vitamin B9 on schizophrenia, administering a very high dose, bioavailable version, methylfolate, in patients living with schizophrenia. And we did see quite large, significant benefits for psychiatric symptoms in schizophrenia from this study, which is very notable. It's a condition that's extremely hard to treat, as anyone working in that field knows. And these are patients who are already receiving antipsychotic treatment. So to see a benefit even beyond that is quite astounding. And furthermore, we also saw in the group receiving the methylfolate in just 12 weeks, changes in the actual brain structure measured in this study. So perhaps high-dose nutrients of the one that is the most evidence-based and appropriate for that condition is the one to do. Or another potential option, which is gaining a lot of traction, is combining nutrition with other areas of lifestyle medicine in mental health. Now, I'm not going to talk too much about this because it's kind of a separate subject, but this is actually my main area of research, and we've published this review just last year, really trying to bring together this overarching field of what we're now calling lifestyle psychiatry, trying to use a number of different modifiable lifestyle health behaviors in improving outcomes in people with mental illness. And we really just tried this review, which this is a bit I wanted to show you, is bringing together the top tier evidence for exercise, diet, smoking, and sleep, and just showing how it really can help. There's all this evidence already available for how these different lifestyle factors can contribute to recovery and also prevention, even preventing the onset of this broad spectrum of mental health conditions. And it sounds like common sense, really. Probably a lot of people here are quite into stuff like this, but it's amazing, like we all would agree with it more than likely. But at the same time, how much is this actually considered in clinical practice for people with mental disorders? How much is lifestyle medicine actually used in treatment compared to just the prescription of an antidepressant or antipsychotic medication? Sorry, I've got some slide timings on. So there's also a growing interest in how does it actually work? We're seeing more and more evidence that diet, nutrition, exercise, things work for people with mental illness. How does it actually work for improving mental well-being? This is a topic that's gaining increasing traction in mainstream medicine, and we was actually asked by the BMJ to produce a special review on how diet and nutrition affect well-being. So a similar approach, looking at the available evidence. The one that we're probably most interested in here today is this hormonal and inflammatory neural microbiome, these direct biological pathways through which nutrition and nutrient supplementation could potentially impact on mental health. And what we mean by mental health is a bit of a tricky topic as well. I think that term is used far too broadly. Do we mean better mood, better brain function, reduced stress? There's all these different types, but there's still preliminary evidence, and we're really trying to get to grips with these direct pathways. There's not much certainty on that at the moment. However, we do have really good certainty that diet can improve mental health through these indirect pathways. We know, obviously, that diet and nutrition is very important for physical health, cardiometabolic diseases, and there's also very, very strong evidence that cardiometabolic diseases impact on people's mental health. So anything that we're doing for physical health, even if you think you're just working in physical health, you're not in mental health, you actually are, I have to tell you, because it's very strong related. And vice versa, the mental health, people with mental illness, that impacts massively on people's physical health in like quite a bi-directional way. It's not as simple to just imagine that poor nutrition leads to mental illness, and then by using the right combination of vitamins and nutrients, you know, hey presto, problem solved. That's not really a realistic way to think about how this works. In fact, when we look at the evidence, it's a complex bi-directional picture. And we see that people with mental illness have higher levels of poor diet, sedentary behavior, which increases their risk of physical health conditions straight away, and also has bidirectional relations with their social functioning, with their cognition, with their brain health, which is then worsened by these physical health conditions that arise in people with mental illness, impacting on the brain and people's social functioning as well. And this is, again, something that we see very, very often, but is not widely considered in mental health care. This is quite a funny little cartoon that actually tells a very sad story about how most patients treated for mental illness actually feel when going to healthcare providers. The body is treated separately to the brain, to the mind. Mental health is sometimes treated at the expense of physical health. A lot of the medications that we use for mental illness do have quite severe physical health consequences that are not really monitored and not really treated in mental health care, unfortunately. It's gaining a little bit more traction, but it still remains one of like the silent inequalities right across the globe. This piece was published in the New York Times, giving it some traction, about the largest health disparity that we see at the moment. Americans with severe mental illness dying 15 to 30 years younger than the general population. And this massive gap in life expectancy is not due to things like suicide or even the mental health causes. It's due to the massively elevated rates of cardiovascular and metabolic diseases that we see in people with mental illness. This is what's killing people young. We see the same thing in the UK, where I'm from. Obviously, you can see over time there, what's even worse about this terrible inequality, it's something that's growing unknowingly, almost unwittingly, over time. As time's going forward, the general health of the general population is improving, and the premature mortality gap for people with mental illness is only getting worse. And this was the basis, this massive inequality was the basis for our recent Lancet Commission on improving physical health in people with mental illness, where we tried to actually draw some new solutions for handling this. We brought together 32 experts from all over the globe, trying to just think about how we can actually start to resolve this massive inequality in physical health that's associated with mental health and mental well-being. Again, the full report is online. I think that's about 12,000 words that'll put you to sleep very fast. But here's a little infographic blueprint just showing the main issues and key actions that we suggested in terms of really trying to promote physical health in mental health care, identifying how there's really high rates of smoking, poor diet, suboptimal prescribing of psychiatric medications, and inadequate health promotion, all leading to really unhealthy lifestyles in people with mental health conditions, and the just general fragmented, inaccessible care that we see. So we need to change this out, start finding some novel methods for promoting physical health for mental well-being, and then increasing the actual utility of this in clinical services, which is really the missing step at the moment. There's some really good examples from all across the world of doing this. In Sydney, they've started using in their early intervention clinics for young people with mental illness. They've built a gym there. They also have a dietitian on site that's actually working with the patients. They take them to the shop to show them how to cook healthy meals. And just in a very short time space, we're seeing reductions in obesity, better functional outcomes in these young people compared to the other clinics in the same area. They've done the same thing in London with their nutritional and exercise intervention on the secure psychiatric wards, and already we're seeing reductions in violence on the ward and improved physical health outcomes. So it sounds like a grand aim, but the people are really doing it right now off their own back almost. There's not much support from health commissioning. Like I said, it's not taken seriously in mental health care, but when it happens, it works. At the University of Manchester, we're starting a new program of research, how to use digital technologies for young people with mental illness to try and look at this poor physical health that we see. This poor physical health, try and identify people's poor, eating patterns, lack of inactivity, and then find behavioral health methods really to promote more healthy lifestyles, hopefully being able to, increase their physical and mental health well-being of the people treated in the youth mental health services. And we're using a number of different qualitative and quantitative measures to see how this can actually be practically implemented in the real world, how we can actually connect physical health to mental health in mental health care. So basically, the goal being, going back to this earlier diagram, what we want to do is switch out this middleman of poor nutrition and sedentary behaviour using the right combination of exercise, physical activity interventions, lifestyle interventions, nutrition, nutrient supplementation, to first of all tackle this poor physical health that we see right across the board in people with mental illness and the massive detrimental impacts that mental well-being seems to have on physical health. And then hopefully we would see straight away just improvements from that on people's brain function. Just by improving physical health, we can improve our brain health, and then also the psychological functioning, social well-being. And now, as we've spoke about today, more and more evidence that these factors themselves have direct impacts on people's cognitive functioning, on their psychiatric symptoms, and their mental well-being overall, trying to use those. So it's not like it's trying to just prevent and cure every single problem, but really just leading to much more favourable outcomes for people with mental illness than what we're seeing at the moment, which is often very poor. So some take-home messages. Diet itself, without any extreme diets, even just a standard Mediterranean diet, seems to be a promising strategy for reducing symptoms of depression across the population. Alongside that, some existing nutrients, like we've said, have quite a good evidence base already, and they've picked up some good traction as add-on treatments for mental illness, and others are really starting to emerge. So I guess this is a call to action for everybody here who's interested in mental health to start thinking about how new supplements that are, there's a lot of research going off in the physical health industry, in the brain health industry. How can these also be utilized? Where is the evidence for these for improving mental health and well-being? There's still a lot to be done. And there's a lot of need as well. I'd just like everybody to recognize the massive unmet need that we see in psychiatry and mental health care for new acceptable treatments that can be used alongside conventional treatments to improve outcomes. And then also alongside this, really much further efforts needed to actually see how diet, nutrition and other things can be actually included in lifestyle medicine in the context of mental health care itself. So, wrapping up there, thanks a lot everybody for coming along and listening to this presentation, and a big thanks to all my collaborators and co-authors that I've listed there as well. Cheers.
Excellent. Thank you so much. Fascinating presentation. I would like to believe that you need your water. You did speak a lot. I found it interesting right at the beginning when you were talking about the difference in the diets, that the women found more of a benefit with the diets, and they're getting the nutrient boosting and even the weight than the men. And I thought, boy, what does that say about society, that the women felt better maybe about themselves even potentially? So how does that tie in with societal expectations, your general health and well-being, and how does that then impact your mental health?
Yeah, that's a really interesting subject, actually. We are, as the evidence continues, we're seeing more of a link between obesity and weight loss with depressive symptoms or improvement in depressive symptoms in that meta-analysis. And we don't actually know what's driving that effect. Is there biological mechanisms between reducing obesity and losing weight? That's implicated in reducing inflammation if we lose weight, especially for obese populations. Or is it more like what you're saying, which seems more likely, that because of the way that society is structured, the stigma associated with obesity, and then actually managing to lose weight being reducing the depression associated with that stigma. Or it could be, often in psychology and psychiatry, we find a combination of psychological, social and biological mechanisms between lots of factors, so it's probably a mixture of those. Yeah.
Any questions from our audience members here? I've got one over here. Hang on.
Thanks. Hi, it's Ron Saltini from Fonterra, New Zealand. Question, you raised a very good question. First, when you have a subject that has both a mental health disorder and a physical disorder, which one do you treat first? So where do you think that it would be coming from? A bit like a chicken and egg type of question. So is a mental health a consequence of a physical disorder, or is the other way around?
Yeah. I think it's actually both. I think it's important to acknowledge the bidirectional relationship and treat it in that way. They really do arise together. The most recent Mendelian randomization studies, which are like a complex epidemiological method for drawing out causal relations from observational data across the population, have actually shown causal pathways from physical health factors and even physical activity to low physical activity or sedentary behaviour in actually causing mental illness. So there's definitely causal pathways in the poor physical health causing mental illness, but then vice versa, somebody who actually is living with a mental health condition, even if the mental health condition has been treated, then they're very likely also to be at much higher risk of cardiometabolic diseases. And part of it is actually, a big part of it, especially in my field, probably the majority of it is due to the medications that are actually needed to treat conditions like schizophrenia. They just have a really massive detrimental impact on people's physical health, which then impacts on their overall mental health as well. One of the young guys that I was working with, for instance, he had his psychosis, he had his first episode of psychosis, was treated with antipsychotic medications, and then he's telling me about it, saying before he actually received any treatment, he obviously had his mental health stuff happening, but he was fine about his physical health. He'd gained 14 kilos in just a few months, so his body type had almost transformed entirely, and then he's feeling terrible. His symptoms of schizophrenia had not even gone away completely, they were just more managed, but then he's dealing with all these. He didn't want to go out and see his friends, he didn't want to go to his work, he just feels like kind of stigmatized by this rapid weight gain and depressed about this. So it impacts, even if we're reducing the psychiatric symptoms, which is all we really measure, we need to do a lot more to counteract these negative physical side effects of the medications. Even antidepressants can have quite significant effects on weight gain, risk of diabetes and things like that as well. So it's important that they get acknowledged more and treated a lot better in mental health care. Thanks.
We've got a question over here.
Thanks, Heather. Great presentation there, Joe. Ian Brownlee, Northumbria University. I suppose my question would be, is there anything that you can share more on the interventions that you're planning on the sort of preclinical groups that you mentioned there in terms of your digital health interventions? I'm particularly interested in the approach that you're taking from a dietary perspective.
Yeah, sure. So we've been, over the last year or so, we've been testing out a number of different digital health approaches to delivering behavioural health and lifestyle interventions for young people with mental health conditions. And what we've found really, we've tested out a lot, just even outside of the context of formal research, just getting people, literally just getting the apps to the patients, getting the interventions to the patients, seeing what people like. A lot of the apps, people really appreciate the technology and say it's a well-designed, well-using app, but they get bored of it and no one really uses it for very long at all. Most of them are very poor for real-world adherence. What people really want is like a sense of connection. So the ones that kind of connect people to like a health coach, not robot health coach, that's not very popular, unfortunately. Real health coaches, or even like peer support groups through an app, through like a system. The Zoom workouts, that's really popular. We're going to start delivering home workouts through the early intervention services soon for everybody who's prescribed through those services. So as much as the apps are kind of well liked in terms of the technology, they're not really going to work, I don't think, by themselves. We need to use technologies as a way to connect people in delivering behavioural health interventions. Same for diet as well, yeah.
I did get a question from our online audience, thank you online audience, asking, do you know anything about how a vegan diet impacts mental health?
Yeah, well, there's some more research coming out about that, and interestingly, it's there's some epidemiological research showing the same, that it might impact men differently to women, with men adopting vegan diets seeming to have a decline in mental health in some epidemiological studies, whereas there's studies showing that in that same sample, the females seem to have an improvement or no worsening of mental health. So there could be a big difference between genders, there could be a big difference between the age groups, what your current dietary pattern is, I imagine, needs to be more taken into account. If someone's living off complete junk food and then they adopt a healthy vegan diet, obviously that's going to be a massive improvement. But if somebody's already just eating a healthy diet, really there's no evidence to suggest that any really specific niche diet outperforms just a general healthy diet in terms of the mental health outcomes yet. There's no compelling evidence that anything beats. Not that it does worse than it, but there's no. Once you're eating healthily, you're probably getting the almost maximum benefits from the diet for your mental health and well-being.
We've got a question here, and then if anybody else has one, just throw your hand up.
I know I said I was going to mess with you. I promise I won't. When you on the nutrient side of things with the supplements, I felt like the list was relatively small. Did you intentionally choose those nutrients to look at, or they just showed up in the studies? Because there was a meta-analysis, so I wasn't sure how you were targeting those nutrients.
No, yeah, we put it the inclusion criteria to literally anything that was out there could be included in that systematic review and meta-analysis if the evidence existed in terms of high-quality meta-analyses that have already been published in peer-reviewed journals. So that really just shows us it's mapping out where the evidence is so far. It's not telling us everything that might work, or there's probably some clinical trials out there of individual nutrients supporting their efficacy, but that's just where the top-tier evidence is so far for those.
Follow-up, I feel like you're the president now. The other part of it is, when it comes to mental health, there's certain nutrients that are driving neurotransmitter production and balancing. And so is that ever, like magnesium was just on one of the slides, I believe, and yet magnesium is like essential for serotonin production, dopamine production, et cetera, choline, serine, et cetera. Is there any futuristic look at maybe targeting the nutrients that are specific to neurotransmitter balancing and brain health? Because omega-3 makes sense because of DHA, but the other ones don't always add up. And I promise I'll leave you alone.
Yeah, I think as we're doing more research, we're gaining a better understanding of how the nutrients actually impact the brain. Those meta-analyses were just actually looking at improvements in clinical symptoms in people, treated with those nutrients, people living with mental disorders. And what we've not seen from magnesium yet is convincing improvements in the treatment of, say, depression. I think that was where the meta-analysis existed so far, finding a null effect. But if we found a way to target it more in specific cases, I know you're a big fan of the personalised medicine stuff, so using that type of approach could potentially see more benefits. I'm not sure.
Okay, we've got a question here.
Good morning, Alessandra Croce from GSK. I have a question because you touched base before on the inflammation as something that could be linked to all these conditions. So I just wanted to understand from your studies, what do you think? Do you think there could be actually a link of inflammation to this kind of mental and psychological conditions? Thank you.
Yeah, I think the evidence really supports inflammation as probably the most widely acknowledged pathway through two things. First of all, through how mental health connects to physical health. People with psychotic disorders, people with depressive disorders tend to have higher levels of inflammation in the body and potentially in the brain than people without. But then similarly, high levels of inflammation also associated with cardiovascular diseases, obviously, metabolic diseases as well. So it connects the two. So that's quite a negative picture of how this inflammatory pathway is creating these vicious cycles between physical and mental health. But then all these lifestyle interventions, be it through reducing your substance use, through improving your physical activity, through improving your diet, through improving your sleep, all these things actually seem to act through the inflammatory pathways as well and can actually reduce inflammation throughout the body. So that it really suggests that those lifestyle medicine interventions could act through those biological pathways to improve that whole picture, the physical health and the mental health with it.
Question here.
Thanks, Joe. Really good presentation, thank you. Mike Wakeman from the UK. A lot of these patients that you're looking at are highly medicated, and we know that a lot of the medications have an impact upon their nutrient status, especially the microbiome. There's a lot of work from Tim Spector now, as you know, looking at the impact of medications on the microbiome. And I'm just wondering whether you've looked at that sort of element in terms of the research that you're planning on doing.
Yeah, it's something that's really important. It influences the psychiatric medications, especially some antidepressants, like the more old school ones like mirtazapine and things like that. Basically all the antipsychotics not only have an impact on the microbiome, like the biological effects, but they also have a massive impact that goes unrecognised on people's actual appetite, and what they're eating day to day changes pretty quickly. And then that is obviously going to have an impact on the microbiome as well. And I think we don't understand yet, and we don't consider those type of factors when we're prescribing the medications whatsoever. It just gets the impact. Perhaps the doctor will tell somebody, oh, you might find it increases your appetite, but then how that's going to impact on that patient's the risk of developing various diseases, the premature mortality, kind of gets overlooked. So it's really important to start researching that and to have dietary interventions that actually apply for people treated with those medications. It's probably different to the general population. You can't prescribe the same diet to somebody taking antipsychotics as somebody not, because it's going to change things quite a lot, and we don't really understand how yet. So, yeah, it's a good area for further research.
Got a question here.
Thanks. Great talk, Joe. I just had one really quick question, which was the effect sizes that you were seeing. How do they stack up compared to the pharma kind of antidepressants or antipsychotics?
Yeah, well, it's real. Usually the effect sizes that we're seeing in the meta-analyses are what we'd call small to moderate. Small to moderate, but bearing in mind that for ethical reasons, they're used on top of the prescribed medications. So the effect that we'd see in an unmedicated patient is really not really known, because it's too difficult to withdraw everybody from the medications and then try the nutrients instead. So you're much less likely to see a very large effect when somebody's already been treated for a condition. In like the prevention studies, I guess we could get more of an idea of like the comparative effects in people with sub-threshold disorders. That's where we might see the biggest benefits even, especially in young people, I believe.
We've got time for one more.
Thank you. Thanks for a great presentation. My name is Lina Lida from Kappa Bioscience. Just a question, have you considered looking into vitamin K and mental health as well? Or is that maybe something to look into the future?
Yeah, we actually published an umbrella review of the benefits of vitamin K across a broad range of health conditions, and it's something that's getting really good traction across a number of different conditions, but not many clinical trials have been published yet in people with actually diagnosed mental disorders. And again, I think if something can benefit someone's physical health, the disconnect that we draw between physical health and mental health in medicine and just in research and everything else is way too definite. The overlap is a lot stronger than we all imagine. So if something benefits someone's physical health, more than likely it can benefit someone's mental health as well.